Okay, guys, let's study turn to notes. Mump infection. Sorry for my English. My English is not perfect, and it's because I studied in Russian language and I just learned like English language through the internet and like videos, watching videos and movies. Okay, the mumps infection etiology is mumps virus. So the transmission is via respiratory droplets and direct contact. So the incubation period is 14 to 16 days, and the range is in between 12 to 25 days. Infectivity period is 7 days periparotitis to 5 days post-parotitis. And the viral replication in the upper respiratory tract drains to the local lymph nodes and then separates to the secondary sites. Okay, let's go through the signs and symptoms. Non-specific prodrome for fever, headache, malaise, myalgia, usually followed within 48 hours by parotid swallowing, secondary to parotitis. And parotid gland is tender and pain worsen with spicy and sour food. On the third infections do not cause clinically apparent salivary gland swallowing and may simply present as an URTI, so upper respiratory tract infection. The investigations. So we are going through investigation through serum, like immunoglobulin positive serology we have to have in the test, and sometimes for the virus we are doing PCR, and we are checking the CBC and serum amylase. So the management, mainly supportive management, analgesics, antipyretics, warm or cold packs to parotid may be soothing. Admit to the hospital if serious complications like meningitis and pancreatitis. That's why we are testing the serum for amylases. So amylases can be elevated because it can one of the complications are pancreatitis. And the thing which is so important in management is vaccination. Always concentrating in a clinical work. Vaccination, immunization is so important for every like infection which we have vaccine for. So you have to concentrate on immunization a lot. So the complication will be common aseptic meningitis and some other complications like encephalitis, pancreatitis, thyroiditis, myocarditis, and etc. So we're going to the Pertussis. This is a bacteria which is called Bordetella pertussis, gram-negative polymorphic rods. Highly contagious, transmitting via the respiratory droplet also, and incubation period is from 6 to 20 days. Most contagious during control phase, but may remain contagious for a week after. So the clinical manifestations, prodromal control stage is from the last lasts from 1 to 7 days, and upper respiratory tract infection was mild cough, sneezing, chorea, was no or low grade fever. So the paroxysmal stage lasts between 4 to 6 weeks, so it is too long, characterized by paroxysm of cough, sometimes followed by inspiratory whoop. I remember in the childhood I had pertussis, and it was quite uh, not pleasant, very bad coughing, and dyspnea even I have. So infant less than 6 months may present with a positive tissue apnea. Positive tussive apnea. WOP is often absent. Onset of attack precipitated by yawning and sneezing in physical exertion. So convalescent stage is lasts from 1 week to 2 weeks, characterized by occasional paroxysm of cough, but decreased frequently and severity. So the investigations which we need to do, it's nasopharyngeal swab and specimen using, and the gold standard will be culture using special media. It's Reagan Low Ager. And the PCR to detect pertussis antigen. Of course, all the time is like most of the times we are using CBC and serology in many infections. And the management is oxygenation. If there is dyspnea and severe cough, and supportive care with attention on nutrition in a young infant. Antimicrobial therapy indicates if Bordetella pertussis isolated or symptoms present for less than 21 days. Use macrolides antibiotics like azithromycin, erythromycin, or clarithromycin. If I'm not making a mistake, pertussis is one of the bacteria which is intracellular, and we need macrolides in order to penetrate to the cell and work on the bacteria to kill. So droplet isolation until 5 days of the treatment and report to the public health. And there's complications which we will not discuss, and you can read by yourself.